I'm here with Dr. Patrice Cristofini, who's the board member director of the European Health Telematics Association. We're talking about e-health today. ITU makes e-health for all in 2015 actually a credible and realistic goal. So what are some of the key drivers that can propel that growth?
It's the capacity to bring not only e-health services focused patient, but also to have a sustainable infrastructure to support the large development of e-health services patient-centric. So it means how we can manage and transport the data in the network and give access to the right healthcare professional at the extremity of the value chain.
So what are some of the different requirements for e-health from the perspective of the patients, the hospitals, and the pharmaceutical companies?
From the patient point of view, it is the concept of patient empowerment. Patient must have access to his or her medical record every time, everywhere, in every country, at home, and on mobility. That's the big challenge to respond to the social demand of the patient. From the point of view of the hospital, how can I modernize my IT infrastructure and reduce my cost? It means how can I share with other structures new cloud computing organization and reduce my internal cost to manage my IT existing infrastructure. And for the pharmaceutical industry, they need to change of paradigm. It's not the healthcare professional, the main target, but it is the patient, because now they need to be sure that when they make a trial, a study, or when they deliver a drug, they need to be sure that patients take the drug. It is the observance concept.
Can you talk to me about the current development of e-health in Europe, keeping in mind that the costs of healthcare and care in general are dramatically rising right now in the EU and in Europe?
The EU level, Europe has a key message. They want to protect and give more progress to the healthcare of the European population or European citizen. Regarding this concept, the main thing is to give access in a cross-boundary system for each patient to their medical healthcare record and to have the capability to show this medical record to the doctors of their choice in the country where they are. The second topic is also to have a billing system which is interoperable between each countries. That's the key message for Europe, and also to push initiative in each country to invest more in ICT, R&D, and innovation.
So talk to me about some of the challenges and the big problems that need to be addressed in order for e-health to continue growing in Europe.
As I explained, very fragmented market, so ICT must be capable to be at the same level of interoperability in each country in Europe. That's the first message. The second message is that in Europe, ICT must help to reduce the cost of investment. And the third message is ICT must help the population to have a better access in healthcare and adapt the level of the social protection at the public economic situation in each country.
All right, so let's talk predictions. Where do you see e-health going from an ICT perspective?
We are facing to a very big revolution. Healthcare is a large topic. I will say one word, bang. It means B, biotechnology, A for nanotechnology, N for new technology, information and communication, and J for genomic or genetic. And innovation will make convergence between these four domains. It will create a lot of data, so ICT must be ready to launch at very large scales, cloud computing, storage, and big data to analyze all the big amount of things we need to manage. It's for the interest of the population and for the institution and the healthcare professionals.
Thank you very much, Dr. Cristofini.
Thank you.